It's a little bit after 5:30, but I want to respect everybody's time. I think we have all the panelists on now. So let me share my screen here. Can y'all see that okay?
Yes.
All right, perfect. So I want to welcome everybody. I'm Andrew Wright. I'm a general surgeon at the UW, and I've been hosting this whole series of virtual visits. We've recorded a number of them. Joanna, I think, posted the link to at least one in the chat. So if you've missed some of the virtual visits, we've had ones with an overview of the residency, one about our different hospitals and rotations. We had several with sort of meet the residents. Those actually weren't recorded because we wanted the opportunity for applicants and residents to chat without that being recorded for posterity. We had one on research, and most recently we had on one about two very important initiatives of the department, one being our wellness initiative and the other being our women's council. And I was actually especially proud of that one. I thought that really showed a lot about our culture here at the UW. Today, obviously, we're talking about diversity, which I don't know how many times I've looked at these slides in the last few minutes, last few days, but we misspelled diversity. So diversity, equity, and inclusion in our department. Let's see. So we have a number of panelists. I'd like everybody to introduce themselves, and then I'm going to hand it over to Dr. Williams, who's going to be presenting the slide. So Dr. Williams, do you want to introduce yourself?
Yeah, can you hear me okay, Andy?
A little scratchy, but sure.
And I'm in the section of emergency general surgery. I went to UW for state over residency and very pleased to faculty. I'm introducing the equity and inclusion initiative.
Estelle, your audio is breaking up there. I'm sorry. Dr. Williams, everything broke up there, I'm afraid.
Dr. Wright, why don't I continue on, and then it'll give Dr. Williams time to
get reconnected.
Perfect.
Yeah. And Estelle, you could also, if the internet Zoom link isn't working, I think there's a phone link you could try calling into.
So, so welcome again, everyone. I'm Dr. Karen Horvath. I'm the program director and also the associate chair for education for the Department of Surgery and the head of our division of education. I am a Northeast to Northwest transplant. I grew up and trained in the Northeast and came out to Seattle for my first position about 22 years ago. And one of the reasons why I've never left is because I love UW. And I'm a GI surgeon. I did pelvic kind of big case surgery for about 15 years, and then moved to the acute care service at the University of Washington Medical Center. And Estell is actually one of my partners, and I'm really enjoying that. My interests are my clinical and research interests are in certainly emergency general surgery, but also necrotizing pancreatitis.
Great. Dr. Wood.
I'm Doug Wood. I'm the chair of the department. And just briefly, I'm a cardiothoracic surgeon. I've spent about a third of my life in the Midwest. That's where I grew up. A third of my life in the Northeast. That's where I trained and spent 17 years in Boston. And then this part of my life, I've all been in the Pacific Northwest. I've now been here at the University of Washington for 28 years. And like Dr. Horvath said, I stay because it's a great place and I love the people I work with. And as you'll see when you're listening to the other folks in our department, it's a pretty wonderful group of people to be associated with. And so for me, that gives me all the joy that I need in my work, and I'm staying put.
Excellent. And Dr. Afolayan.
Hi, I'm Toby Afolayan. I'm a fifth-year general surgery resident. I came to University of Washington actually because of my interest in cardiothoracic surgery. I am going to be going to Baylor Medical Center in Dallas for cardiothoracic surgery fellowship next year. I grew up in Nigeria, came to the United States for college, medical school, all in California, and then I've been in Seattle since I started residency essentially, and I've loved it so far.
And Dr. Wood, the other Dr. Wood.
Hi, yeah, my name is Denzel Wood, the younger Dr. Wood here.
Hey, wait a minute.
just by a couple years here and there. Grew up in the Northeast, grew up in Maryland, went to medical school and undergrad in New York City as well, and then have moved out to Seattle for almost over a year and some change now. It's been better than I could have imagined and have been very glad to be here.
And Dr. Afolayan and Dr. Wood, why don't you just, what service are you on right now?
I'm the chief resident at Harvard Medical Center. I'm the chief resident on one of the two trauma teams, Team 1, and it's one of our Harvard Medical Center is the level 1 trauma center for 5 states. So it's quite a busy service, but we enjoy our time there because of that.
And Dr. Wood, what service are you on these days?
Currently, I'm one of the second-year residents on the transplant service. On that service, we do all the abdominal transplants, so kidney, liver, every so often some pancreas, and small bowel transplants. Been able to have a lot of operative experience, at least at this part of our 2-year with, yesterday I was in the OR with one of our surgeons, essentially from morning till the nighttime, just kind of doing a donor and then doing the transplant for a different recipient. So.
Great. Dr. Williams, have you been able to get back on?
She was trying to call in. She was on here just a minute ago, but I think she's trying to call in right now.
All right. I don't really want to speak for her. I can just at least talk about the agenda, then hopefully she can join us. So here's the agenda that Dr. Williams set for us. I actually, myself, I'm a member of the Diversity Council as well. So I can just say a few words about that. It's actually the Diversity and Inclusion Council. And it is actually a very active part of the department. One of the things I like to really appreciate the senior Dr. Wood for is really his leadership in centering the Diversity and Inclusion Council. And I think that there have been a number of initiatives. I think we all recognize this has been a challenging year, and he's really helped make sure this was part of the department, and that there was a really departmental response to some of the events in the country. Toby, you're also on the Diversity Council. Do you want to say a few words about the Diversity Council? Yes,
so I have been on the Diversity Council as the resident member since my R2 year. Like Dr. Wright said, it's a very active group. We meet very frequently and talk about diversity efforts, from research to community engagement and involvement, and also how we could play an active role in patient care. And so it's one of the projects that I've been most proud of and to be involved with as a resident. And so hopefully we can share that with you today, and you can ask us some questions about that.
And since also we're waiting for Dr. Williams to sign back on, I'll just skip ahead and point out tomorrow is our Harkin Surgical Symposium. This is one of our biggest days of the year. We have an annual visiting professor. And so the full day is of various members of the department giving talks, followed by our Strauss lecture. I just wanted to point out that a big section of this is actually devoted to diversity and inclusion tomorrow, including our visiting professor, Dr. Cornwell, is talking both about diversity in academic surgery, and then as well as talking about outcomes disparities in trauma care. So certainly looking forward to tomorrow's talks. Estell, are you with us yet? If not, I guess we can keep plowing ahead. And I'm sure that Dr. Afolayan and Dr. Wood can talk about a lot of these things. Actually, Dr. Horvath, why don't you talk a little bit about the program? You can tell us a little bit about who our residents are.
Sure. In preparation for this talk, Joanna and I went through our residents and kind of looked at to describe who we are. And we are 50% female, and we have been for quite some time. I would say maybe over 15 years, through a lot of intentional efforts to get to this place. And also 30% of our residents are underrepresented minorities in medicine. And something I'm also extremely proud of. We just talked a little bit about the Diversity Council, and from its inception has been really occupied by both faculty, residents, and staff members. And I think that one of the things I think that really speaks to is including the staff, is I think it's a very obvious in some sense, but sometimes a very kind of a subtle thing that really speaks to the intention of truly creating a culture of diversity and inclusion, because we work not just, it's not just faculty and residents working together, obviously, but it's really our whole team working together. And we really want to promote diversity and inclusion in our entire culture. And I think it's been a very powerful group. They've done a lot of wonderful things. Hopefully Estell will join us, and we'll be able to talk to you a little bit about that. And if not, Toby and Denzel can. One of the ways that we actually support, I think you can say, how do we support diversity and inclusion? And something that we started many years ago, over 10 years ago, was an annual scholarship for both faculty and residents to attend the Society of Black Academic Surgeons meeting every year. And this is something that still the department heavily invests in, and it's really, I think it speaks to our commitment.
And in a number of faculty are active in ESPAS. In Dr. Quiroga, Dr. Williams, I've been, it's a fantastic meeting. If you're not a member of ESPAS, I would certainly recommend joining. I think it's fantastic. I see that Estell, you're on. You want to give it another try? Well, she was there. I see that you're connected.
So,
Or
Dr.
can you hear me at all?
Yeah, go ahead and give it a try. It's a little a little broken, but we'll try. Yes.
Send me a chat if at all cannot can't hear me. I apologize for the technical difficulties. Again, very happy to be here and share what our department is doing. While our diversity council has been was
I'm afraid you're breaking up again, Estelle.
in September.
So Dr.
All right. Well, we'll.
Dr. Wood's credit.
Yes, Dr. Wood, go ahead.
Dr. Carlos Pellegrini's tenure.
Well, I could share some slides about our diversity council to kind of help us get some of the discussion going, because I know Dr. Williams is having technical difficulties, which is perfectly understandable. So do you want me to do that, Dr. Wright?
Oh, sure. Do you have some slides that you can pull up?
I do.
Absolutely.
You'll stop sharing.
Yep. And Joanna, you may need to give him permission to host.
No,
Oh, sure.
It looks like I have it.
Oh, great.
So you're seeing my slides?
Yes.
And Estelle, if you're hearing us, I'm happy for you to jump in and push me out of the way anytime, but just to help in the interim while you're trying to have a better connection, let me talk a little bit about diversity in the department. And I know what Dr. Williams was just showing was our diversity council. We have Dr. Afolayan on this meeting, so he can speak to the working of the Diversity Council directly as well. Dr. Elena Quiroga and Dr. Jorge Reyes are the co-chairs of the group that represents faculty across the department, includes residents from the department, and includes staff from our department. One of the things I'll point out that the work that we do, whether it's wellness, for those of you that listened to us last week about wellness, or whether it's about our efforts in diversity, equity, and inclusion, we are a full community. That means it's the faculty and the residents and our staff. We all support each other. We all have roles in this community of the department. And the staff are important parts of this work that we do as well. So the Diversity Council has actually been in place for 7 years. And its real purpose was to develop best practices, metrics for the department, and to work with leadership of the department, the division chiefs and me as chair, to assure that we are promoting diversity and that we have identified barriers, intentional or unintentional, that might prevent us from achieving what our mission is of being a inclusive and equal department. Some of the things that evolved from the strategic plan of the Diversity Council was having diversity as a part of our mission statement. So if you look on our website or look at the monitor that's near the offices that shows the department mission statement, the mission statement includes a mission relating to diversity and inclusion. There have been an inventory of the activities that we do, as well as what things that we can do to better support residents and faculty. A database developed as part of a survey of the vision and the progress that we want to make. Then there have been aspects of developing the underrepresented medical student sub-internship program. And that's been a very important part of bringing underrepresented minorities here for sub-internships, both to support their interest in surgery, as well as to give them a view of what surgery is like at the University of Washington. And I already made this point about the representation of the Diversity Council. This is the sub-internship program that I am referring to, that we've had 3 sub-interns per year. And we have a great program for them that's both includes the clinical aspect, but also mentorship and some social time and networking with our residents and with our faculty. And I think sometimes it's nice to see, and I'm showing numbers across the whole department. So Dr. Horvath oversees the education program for the whole department and is the program director for the general surgery and preliminary surgery program. But we also have residency programs in plastic surgery, vascular surgery, and cardiothoracic surgery. So on the left side of this is faculty and just what the accomplishments have been over the past 4 years. We've recruited 40 new faculty over the past 4 years, and half of them have been women. 8% underrepresented minorities. So still we're not achieving everything that we need to in recruitment of underrepresented minorities. We do better when we include all persons of color, when we count that, but there still is opportunity for us to be more effective in recruiting underrepresented minorities in medicine. And the number of women on our faculty over the past 5 years have grown from 25% of our faculty to 35% of our faculty. And you can just see what the R1s look like over the past 2 years, and what the current residents and fellows look like in terms of percentages of women, of minorities, and persons of color. And in terms of our applicants from last year, we had 1,200 applicants. This is information that all of you are keen to know, and offered 63 interviews. And you can see that I think we really strive to offer diverse interviews and match to our resident applicants. And this is how our residency program has grown from a very white male program, which all surgery programs were in the 40s, 50s, 60s, and 70s, to fortunately a growing diversity of a program where now about half of our program are white males, and the remainder are other minorities. I'm pausing to give Estell a chance to break in case she's been able to get a better connection.
She's currently driving somewhere where she can get a better connection.
Okay, got it. So I'm just going to go fairly quickly through Women's Council because we talked about this a lot last week, but we have developed a Women's Council as well, made up of faculty and residents. And then a Residents Women's Council that represents issues for female residents. And there have been a lot of accomplishments from the Women's Council. We have an annual grand rounds, both from the Diversity Council and from our Women's Council. They presented a paper this past year looking at the association of sex with perceived career barriers amongst surgeons, based upon a survey amongst faculty and trainees in surgery here. This has developed into really robust mentoring amongst the women faculty, the women trainees, and also the medical students interested in surgery here, with the help of the faculty and residents, we formed the an association of women in the medical students formed the Women in Surgery. And this created a Life as a Surgeon panel session, a mock interview session, and monthly social gatherings represented, I think, by these slides. And some of this work includes aspects of developing policies and having advice from our Women's Council about parental leave policy, issues about pregnancy relating to clinic time, call, operating, maternal and paternal leave, accommodations for lactation. And one of the things I want to emphasize is this bullet point where I'm on the Board of Regents for the American College of Surgeons, and one of our priorities this past year was to develop a strong statement on parental leave for surgical trainees from the American College of Surgeons. And actually, we used work from the Women's Council here at the University of Washington. I was able to take some of the work product from that, the template from that, as we drafted the policy statement for the American College of Surgeons. They're having the important aspect of a national impact of impacting the American Board of Medical Specialties, all the surgical boards, as well as the ACGME, all the surgical RRCs, because they are actually where a lot of the impact takes place of, if there's leave, making sure that there's not negative consequences on eligibility for boards or eligibility for completion of residency. There have been a number of academic projects. I won't go through all of this, but we have an academic project going on about student mentorship, student evaluations, and resident evaluations, looking at aspects like gender and its impact on surgery clerkship grading or on resident summative evaluation comments. And these are the individuals leading some of those projects. So just emphasizing some of the accomplishments in diversity, particularly emphasize Lori Langdale for her award across all of UW Medicine for excellence in mentoring women faculty. She's one of our professors in the Department of Surgery. Dr. Quiroga has been highlighted this year and received a diversity award again this year for her mentorship and leadership in UW Medicine. One of our chief residents, who's heading towards being one of our trauma critical care fellows, Kate Stadelli, has been working in the Somali community and working in a Stop the Bleed program. And Andrea Gall is one of the nurses at Harborview Medical Center, and she took the concept of hashtag I look like a surgeon and began doing portraits, paintings. Andrea Gall is a terrific artist of some of our residents that represent diversity in medicine. And that actually has become a focal point of our hallway in the Department of Surgery. And this is what I'm referring to. There have been several articles about this now in JAMA and in JAMA Surgery, Deck the Halls with Diverse Portraits, and we had a decision to do a remodeling project in the Department of Surgery to move from this, which was our history, a history that we are proud of the chief residents graduating back to the 1950s, but they were very homogeneous, as you can see from what our hallway looked like a couple of years ago. And we wanted to take the paintings of Andrea Gall, and this is what our hallway looks like now, that represents, you know, current or recent residents in our department that Andrea Gall has painted, and represents what we aspire to be as a department and what our goals are in representing diversity and what we look like. And so we think that it's important that the hallways also represent what we want our department to be like, so that somebody walking our hallways sees a department that uh, uh, supports and encourages diversity. So that's just a little quick go through some slides about diversity, and to see if Dr. Williams has had a chance to get to a better connection.
Well, that was fantastic. Thanks for stepping in. And Estelle, anytime you feel like you got a better connection, please feel free to hop on. One other thing I'll just add to Dr. Wood's slides, and this is less a department thing and more a UW-wide thing. Diversity and equity efforts are now actually considered in promotions and tenure explicitly for all of our faculty. So that applies to white faculty as well as minority faculty. So I actually recently revised my entire CV to add a section on my work and how I view diversity and equity in terms of both academics and also clinical care. So I think that's pretty important.
Yeah, Dr. Wright, thank you for bringing that up, because Toby, I'm going to ask you from the Diversity Council. This is work that came from the Diversity Council, and this is exactly what we want to happen. The Diversity Council said we ought to make this part of promotion criteria, and helped us craft what that would be. And it's now been formulated as part of our promotion criteria. Toby, do you want to speak at all about those discussions in the Diversity Council, and how you perceive that effort?
Yeah, I think this was, I remember vividly the meetings we had about this about a year to 2 years ago, when we started having a conversation about the importance of diversity and how we needed to put this in the forefront of professionalism and training and the roadmap for able faculty members. And so there are people like that, are more interested in diversity and diversity efforts. And there are people that are not, the typical basic science research, but are doing research in areas that I think are important, such as diversity and inclusion research. And I think we wanted to make sure that those people are also recognized. And so the department, the council used that as a way to draft an important change in some of the considerations for promotion. And I did hear that there are a few faculty members that have been able to get promoted based on this new criteria. And I think it's important. And I think for me, going into fellowship and ultimately going into a career in cardiothoracic surgery, I would be looking for a department that takes this as seriously as UW does.
I think I also want to highlight the fact that Dr. Afolayan, as a resident, is part of the leadership of these efforts. There's a quote I saw recently: "Diversity is being invited, but or being at the dance, but inclusion is being asked to dance." So the fact that we don't just have people who are members of the committee, but actually part of the leadership and residents that are actively involved, I think is really important. I'm going to flip back to Dr. Williams' slides. Let's see here. So we already talked a lot about the Diversity and Inclusion Council. The mission.
And Dr. Wright, there's a question that maybe we can respond to as well. That is, what has UW's response been to the current social climate? How have the residents been supported during this time? And I think there ought to be like 2 or 3 of us that respond to that. I'll take the first stab at it, but actually like one of the residents to speak up because I think theirs is going to be a more authentic voice of, how they've been supported or have wished they were supported. This has been a really, really difficult time. And I think one of the things that it's helped me recognize as a white middle-aged man, so someone that has uh, all of the unfair advantages that I have taken advantage of, I'm sure, for my whole life. Seeing the impact that has always been there about social injustice and violence against minorities, but having it really emphasized in a way that that we can't ignore, and it requires action. And I think we've tried to be very open about discussing that in the department and being willing to have hard conversations, be willing to have humility about what we don't know. That's one of the things that I've had to own myself, is how ignorant I am, how much I don't know, how much I have to learn, and how much I need to own my own learning as well. I can't count on someone else to teach me. And Dr. Wright has been one of the people that has taught me that part. So I feel like we are all learning from each other. And a big part of the support has been having a community where I feel like we do support each other. But I'm interested in, the residents and their response to that question.
I can kind of give my perspective on, I guess, this past summer and spring and so far. Kind of going through, I mean, for me, that was going through the end of intern year into second year, and all the events that happened from through May up to now were certainly triggering for me, and definitely going through residency is definitely an experience that I wasn't aware was going to have so much of an effect on me going day in and day out. It's work. It was very comforting during that time while I'm like processing my own emotions to be able to see the support that was there. Like, as far as Dr. Wood sending out, and the other Dr. Wood sent out an email to all of us individually to just say, essentially say, I'm here for you. If you'd like to talk, I'm here. If I'm more somebody who kind of processes internally, and it was just comforting to be able to see that email and recognize that the department from top down was aware that these events can have a profound effect on us. And that's something I was not expecting to see just at any surgical program in general. And then going from there, Dr. Williams having her protests with the rest of the UW faculty in front of the courthouse here in Seattle, and seeing that over 1,000 people were there around the corner listening to her. It's just another example I didn't expect to see in that time, and then being able to have the support of the faculty that are on the diversity council or are not, having even NPs ask me how am I doing, even whether or not I wanted to necessarily talk about it at that time. But it's more or less appreciated that it was recognized that this was happening. And I feel like at a lot of programs, we can, in general, being a minority, it's almost the expectation that our coworkers aren't going to acknowledge the fact that these events are happening and are going to go through the day in and day out, as if there aren't these outside events going on in our lives daily. And it has been very comforting and overall supportive for me to know that I'm in a department that is aware of the fact that this can have effect on my emotions and can give me either the support or the space to process through those. And then knowing I have residents such as Toby or some of our other co-residents I can talk to, my co-residents, I feel very comfortable talking about with all these issues in my year. And just overall, I felt like I've been in a very good place to keep working through residency during this time.
And in addition to what Denzel has talked about, I think during that time, the Diversity Council really looked at some of those issues and how it really affected us as residents and faculty members at UW and what role we could play. And in addition to the protest, Dr. Wood has made efforts to actually create a policy regarding bias as it relates to interactions with patients and patient families. And this is something that exists at a lot of big institutions. And we were able to get that instituted at UW to support not just faculty members, but also residents. And create that open channel where underrepresented minorities, especially in our department, had somewhere and someone to turn to openly discuss some of these issues. I think that was something that we all gained and were able to get from that time. So I think overall became a positive moment and a time of change and growth for our department as well, I would say. So in a big way, we felt supported as residents. I felt supported, and I'm happy about that.
I'm just going to share real quick. This is actually a picture from Dr. Williams' talk that she's giving tomorrow. Can you all see that? So this was the march. She and her husband, Edwin Lindo, put out a call. You can see the flyer she put up, and I think there were about 10,000, weren't there, healthcare workers that marched from Harborview to City Hall. It was really a remarkable experience, something I was really profoundly moved by.
And because it was led from within the Department of Surgery, or at least associated with that, we had a full turnout of the Department of Surgery of faculty, trainees, and staff. So we're not 10,000 people, but I would say the majority of the Department of Surgery was there for this demonstration.
So I don't want to give the rest of Dr. Williams' slides were listing some of the things that we do in the department, but I think in the time remaining, maybe it would be best spent talking with our residents and asking some questions. So in addition to the ones, feel free to ask some questions in chat. I also had some that were sent ahead of time.
I think my connection's better now, Andy. Can you hear me?
Oh, there, yeah, perfect. Thank you so much. Well, then I'll put your slides back on.
Oh, you don't have to. You guys did a great job. You didn't need me here.
We absolutely need you here.
We always need you, Dr. Williams.
I'm sorry I don't have my video on, everyone. I don't want to mess up my connection by turning on my video. I'm sorry. I wish I could have you all see my face, but I'm so proud. I love my department. You guys are amazing. You guys definitely show what I get to see every day. So it didn't have to come from me. It came from the people who are actually making this a very supportive environment for faculty members like myself, residents like Toby and Denzel. Sorry about that. Really, we covered mostly everything. I think the only other things I just want to throw in there to make people aware of it, I'm executive director for Dr. for a Day, which is a K-12 outreach program that engages underrepresented K-12 students, engaging them into health care and health careers. And it allows residents, fellows, faculty members to volunteer out in our community spaces, engage in the communities that represent our local area that has the largest concentration of individuals who are underrepresented in healthcare and medicine. And it allows for both the connection to community and as well as engagement in order to increase the pipeline of individuals coming into healthcare. You know, we have the UW Network for Underrepresented Residents and Fellows. I don't know if any of you were able to be at their virtual visit on Monday, but they was actually founded by one of our now faculty members, Dr. Oluwatobi, who's a cardiothoracic surgeon and one of our family medicine residents. And it is our diversity GI equivalent for residents and fellows across all GME resident and fellowship programs at UW. So it allows residents and fellows to engage across different departments and be able to know everyone, because we're a big hospital system. We're in a lot of different locations, and sometimes you don't know where everyone is in all the different departments. So it allows you to engage and see where diversity exists in other departments as well to create a bigger community. We also have the Office of Healthcare Equity, which is a UW medicine system-wide office that does diversity, equity, inclusion work across the UW medicine system. Everything from medical student engagement to engagement with our patients in our healthcare system, ensuring that we are meeting the needs of our most marginalized patients. Within the Department of Surgery, we have established BABES, which is Black and Brown Excellence in Surgery, which is our Diversity Council's initiative to engage our residents and fellows socially and from a professional development standpoint. We have monthly meetings that the food and drinks are paid for by the Department of Surgery. Thank you, Dr. Wood. We appreciate that. And it allows our diverse residents and fellows to get together and fellowship with each other so that we can have time outside of the hospital to engage, build relationship, build community, and do professional development. Our last topic for the session we just had this past week was around navigating difficult attendings and senior residents. So it just gives us an opportunity to speak in a safe space about how do you navigate some of the workforce difficulties and other things on professional development, or targeting different times of year, different topics that are relevant. So recruitment and retention in like the spring, CV development for those who are going on. You know, another initiative that has just been developed in conjunction with OHSU and UCSF is actually a regional mentorship program. So here on the West Coast, things are a bit spread out. It's harder for us to engage. It's very different than some of you maybe coming from the East Coast, where there are like 5 schools and like a 5-block radius. You can actually engage and have relationships with a lot of different institutions and faculty. But here we're more spread out, and because our numbers are small and we're spread out, it does make it a little bit harder when you're trying to look for mentorship, especially if you're looking for mentorship coming from other underrepresented minorities, and especially those with surgery, given the paucity of underrepresented minorities in academic surgery. And so REPRES was developed through the support of Dr. Wood and the chairs at both UCSF and OHSU, and was a brainchild of Dr. Don Spite, who is an MIS professor at OHSU, and Dr. Andre Campbell, who is the vice provost for diversity and inclusion at UCSF, and myself, to basically form a regional mentorship program for underrepresented minorities in order to ensure that along this coast we can really, although we have small numbers, we are small but mighty, and we can be stronger together by forming a regional collaboration. We've already mentioned the Society of Black Academic Surgeons, and we have an institutional membership that actually covers residents and fellows to attend the conference every year. And we were just successful in getting the institutional membership to the Latino Surgical Society as well. And so we have a lot of institutional presence within these very well-respected organizations. And so it is wonderful to know that the institution is willing to put their backing behind our presence at these levels. We can go to the next slide. Thanks, Andy. The additional diversity and inclusion work, and a lot of these things are just honestly have come about as a result of the uprising. They mentioned the march that my husband and I led, and as a result of that sort of introspective evaluation that we did within the department about how can we work from a place of action. So it is wonderful to be able to support and make people feel heard and listened to. It is wonderful to be able to have these conversations, but it has to go past that. So we have to be able to look at how do we actually start to change the world so that it can reflect what we want it to be. And part of that that is the development of quarterly cultural M&M. And this was developed actually in collaboration with the University of Michigan and University of Maryland that developed the cultural M&M. And we here at the University of Washington are looking to establish that as well. There's a Department of Surgery Cultural Book Club that is being developed in order to use, not just rely on academic literature, but what are a lot of the thought leaders in the space around looking at racism and anti-racism saying, and how can we be involved in those conversations? And honestly, whatever ideas faculty, staff, residents, and fellows bring to the table, and that includes you, the future of our department. This department is very open to instituting wonderful, innovative ideas that people bring. And we want to continue to bring in additional thought leaders and people who are going to push the envelope and really engage in a thoughtful, meaningful way about how do we continue to advance as a surgeon. And I just want to add a little personal anecdote. I do want to leave time for questions. I'm sorry I jumped in late. This was all supposed to be said much earlier, but I think a lot of my identity struggled when I was deciding to be a surgeon because I felt like I didn't have a place. This has always been my passion to engage in this work, but I didn't actually have examples about how this can be done. And I feel so fortunate I found a department that has allowed me to own that identity in myself and flourish within that space. As a surgeon, being engaged and passionate about diversity and equity and inclusion and health disparities and healthcare outcomes for marginalized populations. And in doing so, really able to really change the narrative of how a surgeon can be engaged in this work. So I think I have one more slide that was just talking about the community life in Seattle. It's a slide of everything, but just wanted to show the Burke Museum or Daybreak Star, which is our Native American cultural center up by the Discovery Park. We have Africatown in Central District, International District, Northwest African American Museum. But I just want to throw that plug in there that there's a lot more culture in the city than you might hear from on any other TV or advertisements. Like I say, living in Seattle for years now, coming from Oakland, California, I've been pleasantly surprised and super enriched by my experience here at UW.
And Dr. Williams is too modest to mention she has actually founded a anti-racist library and bookstore herself. So. I'll always have to promote Estellita's library. That was fantastic, and I'm so glad that you were able to review those. There's a question sent in. I think Toby, you touched on this briefly, but a question about the fact that oftentimes faculty and co-residents are supportive, but that a lot of the racism that is experienced by residents is actually directed from patients. And especially in a safety net environment, it's hard because you can't necessarily walk away from those patients, and how that works in our system and what kind of support that you might have if something like that happens.
Yeah, thanks for asking that question. I was alluding to this earlier. Our chair, Dr. Wood, and I have actually collaborated a little bit more with his efforts in trying to push a policy that's really seen in a lot of institutions, but UW has actually created a policy where one, we're working on the reporting system, which should be live or will be live soon, but there is actually a tool that guides administrators on what to do when these instances happen. So there is a policy at UW Medicine for this that's recently been created in the last few months around the recent atmosphere and there is a reporting tool that Dr. Wood, please correct me, it looks like it's being created or it's being finalized so that residents can report this. But more importantly, I think I've always pushed that this needs to be anonymous, and sometimes people don't feel comfortable reporting electronically, and they feel more comfortable reporting, talking about it to other people. I think the BABES group, the Black and Brown Excellence in Surgery group, it's one of the reasons why that group exists and has been supported by the department, so that even if you don't want to report this, you can talk to the attendants there, the co-residents there, people like myself who feel bold and feel who are able to guide and initiate an action based on those events.
Yeah, and I'll comment on the policy because, yeah, Dr. Afolayan and I have talked about this a couple of times, but my push for this policy actually preceded all of the events of this year. It comes from actually over a year ago, a paper published about a similar policy at Mayo Clinic. And actually, I do not think that this is very widespread in most institutions. It is becoming an area of people paying attention to it. But I was really struck by the policy that Mayo Clinic had developed and brought that to the leadership of UW Medicine. And that is what is brought us to having a policy that just like there's a code of conduct for us, that there's a code of conduct for patients and patient families, and that it's spelled out, it's bullet points, and it includes things like they cannot request a preferred provider. So when they come into the emergency room, they can't say, I don't want this kind of provider or that kind of provider, or hide it in some couched language that makes it appear different than it is. You know, those microaggressions. And then of course, there's also the macroaggressions where there's, you know, overt racism in communication. And, you know, that does occur. We've had people that have suffered and been victims from patient aggression that is macroaggression. And you know, this also creates clear guidance of what the code of conduct is for patients and the consequences when that is not followed, and a mechanism for reporting it. And Dr. Afolayan pointed out that, you know, mechanisms are only as powerful as people are willing to use them. But part of it is, you know, trying to change the culture of the staff, residents, and faculty so that we step up and support each other. Part of this is so that when one of us witnesses an event, that we can step up in the moment and support the nurse or the respiratory therapist or the resident who has suffered a micro or macroaggression.
It's 6:30, but since we had so many technical issues, and I think discussion here is really important. If folks don't mind sticking around for a couple more minutes, I think that would be fantastic. I want to direct some questions to Dr. Afolayan and the younger Dr. Wood about living in Seattle as a person of color and what that's been like for you.
So I've lived in Seattle for about 4 years now. I moved from California. That I would say the area I lived in California was a little bit more diverse than Seattle. I actually think overall the diversity in Seattle is a lot more elaborate than people think. For instance, even I know about the African communities, and I think because of the technology firms that are in the environment, it's a lot bigger, and there are a lot of African communities and societies that I didn't know of until about a few years ago. So I think to speak bluntly, the amount of racism that you get in Seattle is probably about the same as other states, and I don't think that's a bigger factor, especially in the city of Seattle itself. Outside Seattle is a different factor. I think the diversity here is actually great because most of my friends are actually not in medicine. I spend a lot of time with folks from different other professions because of how sort of diverse Seattle is. So it's a great place to live. I never thought I was going to like it as much as I do now. And I think it's going to be a little bit difficult to leave this environment because I've built such a great network in a very short period of time.
Dr. Wood, you've been here now a little over a year. Of course, half of that's been under COVID. So,
right. And coming from New York City, I think almost by default, New York City is probably the most diverse place in the country. I kind of rolling into year 2 now. I've been surprised by the diversity that is here in Seattle. It's both different, obviously, because we're in the Pacific Northwest, but in the same manner as Toby, I've already pretty quickly built a network outside of my residency class that of other people who are either minorities, either from New York City, from the Northeast, and have been able to kind of build that social support network outside of residency because of that, which has been interesting and has been fun to realize how quickly I've been able to build that. So it's been, aside from the fact that COVID is ongoing now, it's overall been a good experience. I feel pretty fortunate to be here and pretty fortunate to be able to build that network, explore Seattle, find my new local food spots, and go from there.
Dr. Williams
Toby?
put her email in the chat. So if folks want to reach out to her, have sensitive questions they don't feel comfortable asking here, she provided her email address. Sorry, what was that?
Yeah.
Dr.?
Oh, no, it's me. I just wanted to add, Toby needs to tell everybody how I know his cousin before he ever even moved here.
Yes, that's true. My second cousin works for a law firm in Seattle, and Dr. Williams actually spends more time with my cousin than I do, sadly.
There were a number of questions about LGBTQ issues. Diversity is just that. There's a diversity of issues within diversity. I think I saw a statistic actually just this week that aside from San Francisco, Seattle actually has the highest proportion of residents that identify as LGBTQ+. It is an extraordinarily welcoming environment for folks who are LGBTQ. So I don't know if any of the other panelists have a comment about that, but I think Seattle is extraordinarily welcoming.
We've had a number of residents, including 2 of our prior chiefs, Dr. Morgan Richards, who just graduated my same year, and her partner. They had 2 children during their time while she was a resident here. And then we had Dr. Fitzgibbons, who was the chief when I was, I think during my sub-I or when I was in MS3, I think during my time at Harborview, that I recall. And currently, even within our department now, we've done an excellent job within some of the other divisions like plastic surgery, talking about gender affirming care for our transgender patients and educating our surgical community about care for those patients. I think that this is something that always requires individuals from those backgrounds to add guidance, because it is always best to have those communities speaking for themselves, to have other individuals speaking for them. But I want to echo exactly what you said, Andy, that the Seattle area and the Seattle community is very engaging and enriching for our LGBTQ+ population, and I think the UW as well, with a lot of the care that we provide and specifically seeking to ensure that we're taking care of them as a marginalized population who experiences even more disparities, and especially as you talk about our Black trans patients, et cetera, dying at higher rates than other trans people, and just making sure that we're addressing all of the disparities that exist around those populations.
Yeah, and just as a small point, I know this is getting more common across the country, but we were one of the early places to actually ask all of our patients their preferred pronouns. And that's actually included in part of our intake. There was a question about outreach projects, including Hispanics. Unfortunately, Dr. Quiroga is not with us today. She's one of our vascular surgeons and has really been very involved. But any of the panelists want to comment on that?
Yeah, I'm happy to briefly, Andy. There are a lot of initiatives actually within the UW system and partnerships. I think the beauty of UW is that all the departments actually work together. So even though we're a big institution, you can feel like you get lost. There's a lot of interdisciplinary collaboration. You know, we have now the Diabetes Center at South Lake Union that is for Latinx patients only. So, and Dr. Quiroga is actively working within Harborview to actually create the same for the vascular surgery program as well. And I believe that is, it is close to being finalized. And there is a collaboration among a number of Spanish-speaking Latinx faculty members that from the MA checking the patient in all the way to the vascular surgeon, the podiatrist, the anesthesiologist who will be delivering anesthesia care when the patient goes to sleep. All of them are Latinx identifying and Spanish speaking, so that that population is able to receive culturally relevant care in a language that is their first language. In regards to additional outreach efforts, you know, within my program, Doctor for a Day, we specifically target our populations, again, that are underrepresented in medicine, and that includes our Latinx population. So I'm thinking about earlier, just the pre-medical education outreach. You know, one of the sessions we held at Chase Lake School had 60% of our students who participated were Spanish speaking with English as a second language, and we had an on-site interpreter for the parents and the students there during the duration of the program. We have a number of other faculty members. I could go on, everything from Natalia Jimenez, who is at Seattle Children's, who is engaged in health disparities work, and to Dr. Edwin Lindo, who is our, I have to give a plug, he is my husband, but he is also the assistant dean for social and health justice within the School of Medicine. So there are a lot of different places within the UW to get plugged in that specifically addresses the needs of our Latinx population.
Thank you, Dr. Williams. Had a number of other questions that were sent in. A lot of them were about the UW surgery's response to BLM. I think those were sent in before Dr. Wood talked about that. And we question about initiatives on improving the program. I think Dr. Williams addressed a number of those initiatives. I do want to point out that we, I think, all recognize throughout the entire department that this is ongoing work. This is not something we look at as, okay, we're going to do this one project and then we're done. It's an imperfect system, and you know, we have decades, hundreds of years of systemic racism in our institutions, in our own institution, in our own selves. And so I think that any of the projects you hear us talking about, if you come back in a year, you'll hear us talking about new projects, because it's an ongoing process. Here's a question. Could any of the residents talk about balancing surgical training and their research interests alongside community outreach and access to healthcare? I can ask our two residents on the line, or Dr. Williams was one of our residents before she became one of our faculty. So I'll ask all three of you.
Well, I didn't take dedicated time off for research, but I was able to partake in some research projects and present both nationally and internationally on those projects. And I think the structure of the residency supports you to be able to both do dedicated time and do research through that arm, or through your clinical 5 years going straight through and having a faculty mentor who's dedicated towards research, which I have someone who has mentored me from my intern year, just really for research and thinking about projects. And for community outreach, I've been lucky enough to have been involved in a few outreach projects that are outside UW medicine, but I was doing that before residency, and I was able to find time to continue that. It does get challenging as you go along the way, but I think that's part of the training in trying to find time to balance. And I think the way to get around that is to identify mentors who can guide you and teach you how to navigate some of those challenges.
Yeah, I think being one of the junior residents, part of that question is one of my questions, and slowly developing that way to balance those interests that I have and find those areas in the residency schedule where I know, okay, this is a good 3-month window to really start this project and kick it up. And I've already started to have discussions with Dr. Williams about what projects she's working on now, and hoping to start to build on that as we roll into the fall and the winter here.
Yeah, and I think it's possible to combine sometimes these things. So combining an interest in education with an interest in advocacy, for example, or an interest in research and advocacy. A project that I'm working on with one of our residents right now is looking at are there disparities in access to telehealth services? Telehealth has grown up dramatically over the last few months, and we're noticing that there are disparities in who has access. So it's both a research project, a QI project, but also an outreach project, sort of all wrapped up together.
Yeah, and I just want to add, I'll both echo what Toby said and what you said, Dr. Wright. It really is finding that balance in your time. As Dr. Afolayan stated, you really are going to be really trying to navigate how do you fit all these things into your schedules. And that is something that having a mentor, and the idea is you're going to have multiple mentors, and all of us do. You have the person who's able to help you navigate research, the person who's help you navigate your overall career development, your personal life, and how those personal interests interplay with all of these things. And so there isn't just one mentor that's going to be able to help you navigate all of these. It's really going to be a mentorship team. And I think that's what I would impress upon you all to think about now as you are engaging on your path in your overall career development, is really developing that mentorship team who will help you navigate all of these different things. And I want to add a bit of a personal anecdote to this story, because this was something that I struggled with very strongly when I entered my surgical training. This was engaging in both research and a lot of community outreach. As by my current role within the School of Medicine, running my outreach program now, a lot of those interests were developed before I even came into medical school. I worked for 2 years before coming into medical school, and I worked as a program coordinator for the Alameda County Public Health Department, that coordinated a consortium of 16 different programs throughout the county that addressed healthcare workforce diversification. And I continued those efforts through medical school. But when I entered residency, I all of a sudden felt very torn, because surgical residency is so demanding. And I started to find myself getting a bit depressed. And I don't know if Karen remembers this meeting, but Dr. Horvath, I came and sat in her office, and I told her, I said, I find myself getting depressed. I think I need more investment in these things that have given me my passion and drive for medicine from the beginning. And she looked at me, she said, Estelle, if this is something that you are dedicated to, I am completely supportive. How can I help you? Now, granted, she also told me that I had to make sure I kept up with maintaining my clinical responsibilities, but as long as I did that, she would be in full support. And I think that is something that I have carried with me my entire career. and why I am successful now is that the UW has always provided that sort of senior mentorship and support to help me engage in all of these things. And so if you have something that you are passionate about doing, I always say a closed mouth doesn't get fed. You have to go and talk to your mentors. You have to talk to the people in the department and make it known, and they will find a way to help support that and make it happen. Because if you're here in this program, we're invested in you. We want to see you successful. And so finding the best way to make that happen is what everyone in the department is truly dedicated to doing.
Wow, I don't think anybody can top that, Dr. Williams. So that might be a good note to close on. I think all of us are very approachable, both the residents, the faculty. So if you have questions, feel free to reach out to Joanna, and she can route you to any of us. So thank you all for joining us this evening.
Thank you.
Thank you, Andy, for moderating, for leading. Thank you all for coming.
Thank you. Good night.